Abby. I'm Mikayla. I'll be your nurse today. What brings you in?
Well, my doctor recently told me that I have atherosclerosis, but since I have no symptoms, I don't really know what that means.
Well, it says right here that your blood cholesterol and your blood pressure were both high, which are symptoms of atherosclerosis, but you may not have been aware of those without the test. Some later symptoms are chest pain and angina, but the fact that you haven't had any symptoms is perfectly normal. Let me explain to you a little bit about the normal physiology of your blood vessels, as well as the pathophysiology of atherosclerosis, and then maybe you'll understand it a little bit better.
Okay.
Your blood vessels consist of 3 layers. The innermost layer is the tunica intima, which contains the endothelium tissues made of simple squamous cells that line the lumen of all vessels. The flat cells fit closely together, forming a slick surface that minimizes friction as blood moves through the lumen. The second layer is the tunica media, and is made up of mostly circular, smooth muscle cells and sheets of elastin. Activities of the tunica media are critical in regulating circulatory dynamics because small changes in vessel diameter greatly influence blood flow and blood pressure. The outermost layer is the tunica externa, which is composed largely of loose woven collagen fibers that protect and reinforce the vessels and anchor it to surrounding structures.
In homeostatic conditions, the blood vessels remain under low friction in order to pass blood freely throughout the body. The blood is responsible for transferring cholesterol through the use of transport proteins around the body to be used in the cell membrane. The 2 types of proteins used in the transport of cholesterol are high-density and low-density lipoproteins. Low-density lipoproteins carry cholesterol to tissues, while high-density lipoproteins transfer excess cholesterol to the liver, where it becomes a part of bile for elimination in order to maintain homeostasis. Lipoproteins are made of phospholipids and proteins and act like a cell membrane around the lipid. The protein used in a lipoprotein is called an apoprotein, which plays a role in the interaction between the vesicle and the cell. The apoprotein binds onto receptors on the cell, which allows the cell to absorb it and therefore absorb the cholesterol and maintain homeostasis.
Inflammation in the blood vessels is normally a protective role in the body against pathogens. In atherosclerosis, the large arteries, such as the aorta, coronary, or renal, become hardened over time due to the buildup of plaque as a result of an inflammatory response, which changes the elasticity of the arterial wall. Atherosclerosis does not affect the viscosity of the blood. Several factors can lead to inflammation of the arteries, including age, exercise, or lack of, and the diet. Diet affects the development of atherosclerosis, especially in regards to vitamin D consumption, since the blood vessels have receptors on their cells for vitamin D. The receptors activate vitamin D, which causes the vessel to become more relaxed and flexible. So when there's a lack of vitamin D, this does not occur. Vitamin D also contributes to vitamin C absorption. When vitamin C is not absorbed, it also contributes to the development of plaque. HDL and LDL are both normally found in the body, and like I said earlier, are important in the transport of cholesterol. In normal physiology, there should be a higher amount of HDL in the bloodstream than LDL. In people at risk or with atherosclerosis, this ratio is off, meaning that there is more LDL than HDL. Therefore, the HDL cannot properly excrete the LDL, which contributes to excess formation of plaque.
There are 3 components to plaque associated with atherosclerosis. Fatty streaks are yellow and smooth and progressively enlarge by becoming thicker and slightly elevated to protrude into the lumen of the artery. They consist of macrophages and smooth muscle cells that become distended with lipid to form foam cells. LDLs become oxidized and damage the endothelium lining, which causes inflammation and attracts macrophages. Foam cells then attract more LDL, which further oxidizes the endothelium, causing more damage. The fibrous atheromatous plaque is characterized by the accumulation of lipids, formation of scar tissue, and calcification. As the lesions increase in size, they encroach on the lumen of the artery and eventually occlude the vessel and reduce the blood flow. Rupturing of the arteries is dangerous because the underlying tissue becomes exposed and platelets could stick, which would initiate the process of clotting.
Narrowing of the arterial lumen stimulates the development of collateral circulation, which consists of pre-existing vessels that enlarge to reroute blood flow. Collateral flow allows continued perfusion to the tissues beyond the arterial obstruction, but is inadequate to meet metabolic demand. As a result, the blood pressure will then increase in order to compensate for the restricted blood flow in the artery to ensure adequate blood is being transported throughout the body.
Let's review the key concepts. In order to maintain homeostasis, blood vessels need to maintain decreased friction. Two ways they do this is by maintaining the HDL to LDL ratio, where HDL is higher, and they also use inflammation to restore the blood vessels back to homeostasis. Proteins involved are apoproteins and lipoproteins, and the cell membrane is affected by the transportation of cholesterol in the blood to the cell membrane.
In summary, pretend that this is a normal artery, free of obstructions, which allows blood to flow freely. And pretend this is an artery with atherosclerosis, where the buildup of plaque has partially occluded the artery, resulting in inadequate blood flow, which then results in high blood pressure. So, Abby, does atherosclerosis make more sense to you now?
Yes, I think so.
Yeah, do you have any more questions?
No, thanks, nurse.
You're welcome.